Hi everyone, I'm Dr. Lynn Wagner and you are listening to The Wealthy Life. Today we're going to discuss body composition and why it matters, and I'm going to spend some time actually talking about the InBody device, which is something we use at Wagner Integrative Health that can look at your body composition. For years in medicine, we looked at patients' weight and we looked at their BMI, and then we judged them and their health based on those numbers. But the truth is that that's not the whole picture. Body composition is so important. So how much muscle you have compared to how much fat, how much body water you're containing, those things are all great predictors of whether you're going to develop diseases and how healthy you are. Muscle is so important because it is a metabolism booster. It helps you stay lean and stay at a healthy weight. It obviously keeps you strong and allows you to do the things you love to do. It's a predictor of longevity, and it's a metabolic health protector, meaning it prevents you from developing things like diabetes and insulin resistance, cardiovascular disease, and other chronic diseases. And obviously muscle also just looks really good, so people feel better when they have more muscle. Fat, on the other hand, is not fabulous. So there are good things about fat. It's an insulator and protector. It helps you make certain hormones, and it is an energy reserve. So having too low of fat obviously isn't great, but as most people know, high fat is bad. So when you have high fat, you're going to have more inflammation, it's going to disrupt your hormones, and it's going to stress out your organs. You can imagine if your organs have to work with all that extra body fat, they're going to work harder and they might wear out faster. So that's what we're looking at when we look at body composition. At Wagner Integrative Health, like I discussed, we use this device called the InBody. So it's a bioelectrical impedance analysis device. It's a lot of words, but basically it's sending low-level electrical currents throughout your body. And the fact is, tissues conduct that electrical current differently. So the device can tell how much muscle you have and how much fat you have based on that conductivity. So it gives you really cool percentages so you can see how much muscle do I have, how much fat do I have, how do I need to change my stats. And when you're using this device, it's important to know how to read it. So a lot of patients will get this big printout and they're like, how do I use this printout to make healthy changes without having to talk to my doctor about it? So we're going to actually walk through an example report here, and I'll tell you exactly how to do that. Here we go. So here's an example of an InBody report, and as you can see, it's going to tell you some patient data, their age, their height, their sex, the date it was done, and then the way you can read it if you're trying to read yours on your own is, first of all, what I want to show you is way at the bottom. Now this person only had one scan done, but as you come in for sequential scans, whether it's every month, every 3 months, twice a year, you're going to see trends. So if this patient loses weight, you're going to see this go up or down. If they're gaining muscle, this is going to go up, et cetera, et cetera. So you can actually see trends. And this is really important, especially for people who are using weight loss drugs, specifically like the GLPs. These drugs are known to cause muscle loss. So let's say you're someone who had a 10-pound weight loss, but 7 pounds of that was muscle. You actually harmed yourself more than making yourself better, even though you lost weight. So that's how this part can be really cool. Other things that we like to look at with this scan is, I'll just kind of go from top to bottom. So at the top right, you have this body fat, lean mass body control. So that is basically the machine telling you how much fat you should either gain or lose, or how much body mass, meaning muscle, you should gain or lose. And that's going to be different for everyone. So if you're someone who's skinny fat, it might tell you to gain muscle, and it might tell you to lose fat even though you're normal weight. If you're someone who's overweight and has a lot of body fat, it might tell you to have, that your muscle mass is great, but that you just need to lose body fat. So that can kind of help guide you with your goals. It's not perfect. I have patients who are older and they're carrying more body fat, and the machine is telling them to lose 60 pounds, but when I look at them, I'm like, realistically, I think 40 pounds is probably going to look best on you and also be really healthy. So it's not perfect. The other thing I like to look at with the InBody is this visceral fat score here. So visceral fat is the fat that you carry around your organs, and that is known to be very inflammatory and put you at risk for certain diseases. So you want to have that visceral fat be really low. I say for most patients under 10, ideally between 6 and 8 is great, 4 is fine, but you want your body visceral fat to be really nice and low, and that feels really good too, because no one likes to have a lot of fat in their midsection. I also like to look at their basal metabolic rate. So that means how many calories does your body burn without doing anything every day. So if you just lay like broccoli all day long, how many calories will you burn? If you're someone who's counting calories, or you feel like you need to eat more calories, you can use that when you're calorie tracking. Then I go back up to the top here, and I like to look at this muscle fat analysis section. So take home point with this is you want it to be a D curve, which means that from the top bar to the bottom bar, if you drew a line, you would have a D. And that basically means that you have more muscle than you do fat. And that is a very healthy body composition. If you see the opposite, which is a C curve, which you can imagine if this skeletal muscle mass was low and the body fat was high, it would be more of a C curve. That's going to be more of an inflamed body and a non-ideal body composition. The other thing to know about these metrics here is you're going to see the arrow pointing down, the arrow pointing up, and then the middle one, which is just flat. The flat one in the middle is average. So when you're looking at like this person's scan, their muscle mass, they have above average muscle mass, which is excellent. You actually probably want to be more than above average. And they have low body fat, so lower than average. So that's what these arrows mean as well. The next thing we look at is the obesity analysis. So it will calculate a BMI for you, and I never look at that because if you have their body composition, BMI really doesn't matter, but percent body fat is really important. So average is here, a little bit under percentage is fine. Once you're getting over average, that's when you're going to have more risk for disease and disability, and you're not going to feel as good about yourself. Also, if the body fat gets too low, that's when we start to see women not having their periods, or they're more at risk for things like osteoporosis, or they might have unhealthy hormone production. So you also don't want your body fat to get too low. And then segmental lean analysis is also very cool, especially if you're doing like a strength training program, because you can tell how much muscle you have in each extremity and your trunk and how they compare to each other. So this person specifically looks pretty balanced. Right versus left is pretty equal. The legs are pretty equal. The trunk is great. There is more muscle in this person's legs than their arms. So if they wanted to actually improve their body composition, you might tell them to lift heavier or more frequently with their upper extremities. But overall, I would say this is a pretty good scan. And then lastly, the body water analysis. So this is going to tell you how much body water you're carrying. If you're in the low section over here, you might just be dehydrated. That's easy to fix. Drink some water. In clinic, it's very interesting because when patients tend to be on this side a little bit too high, there often are patients who have chronic inflammation, because chronic inflammation leads to you retaining water. So it can be a marker of inflammation for some patients. So again, just to recap it, body composition is super important. InBodies are everywhere, so there are a lot of fitness centers that have them. At Wagner Integrative Health, you can pay a very small fee and get one if you're not our patient. If you are our patient, they are free, and I encourage you to do them regularly, even if you're not trying to lose weight, because even if you're not trying to lose weight, having more muscle is going to protect your bones, all the things I already mentioned. And then when you're reading it, again, you want to look at, you want the D curve versus the C curve, so you want your muscle mass to be greater than your fat mass. You want to look at what the machine is recommending for how much muscle you should gain or lose, or how much fat you should gain or lose. You want your visceral fat to be nice and low. You can use your metabolic rate to decide how many calories you should eat every day if you're a calorie tracker. And you want your body fat to be healthy, and you want your limbs to be somewhat symmetrical. Doesn't have to be perfect. And with that, you can optimize your body composition and give yourself a very healthy, happy, and strong life. Hope that helped.